Welcome to NCLEX over NCLEX. This video is about fundamentals of nursing. Please pause every after question for more time and to read rationales. Question number 1. After a client has been premedicated for surgery with an opioid analgesic, the nurse discovers that the operative permit has not been signed. What action should the nurse implement? A. Notify the surgeon that the consent form has not been signed. B. Read the consent form to the client before witnessing the client's signature. C. Determine if the client's spouse is willing to sign the consent form. D. Administer an opioid antagonist prior to obtaining the client's signature. Answer. A. Rationale. Once a client has been premedicated for surgery with any type of sedative, legal informed consent is not possible, so the nurse must notify the surgeon. A. B, C, and D are not legally viable options for ensuring informed consent. Question 2. A client is demonstrating a positive Chavostic sign. What action should the nurse take? A. Observe the client's pupil size in response to light. B. Ask the client about numbness or tingling in the hands. C. Assess the client's serum potassium level. D. Restrict dietary intake of calcium-rich foods. Answer. B. Rationale. A positive Chavostic sign is an indication of hypocalcemia, so the client should be assessed for the subjective symptoms of hypocalcemia, such as numbness or tingling of the hands. B. Or feet. A and C are unrelated assessment data. D is contraindicated because the client is hypocalcemic and needs additional dietary calcium. Question 3. A male client with acquired immunodeficiency syndrome, AIDS, develops cryptococcal meningitis and tells the nurse he does not want to be resuscitated if his breathing stops. What action should the nurse implement? A. Document the client's request in the medical record. B. Ask the client if this decision has been discussed with his healthcare provider. C. Inform the client that a written, notarized advance directive is required to withhold resuscitation efforts. D. Advise the client to designate a person to make healthcare decisions when the client is unable to do so. Answer. B. Rationale. Advance directives are written statements of a person's wishes regarding medical care, and verbal directives may be given to a healthcare provider with specific instructions in the presence of two witnesses. To obtain this prescription, the client should discuss his choice with the healthcare provider. B. A. Is insufficient to implement the client's request without legal consequences. Although C and D provide legal protection of the client's wishes, the present request needs additional action. Which statement is an example of a correctly written nursing diagnosis statement? A. Altered tissue perfusion related to congestive heart failure. B. Altered urinary elimination related to urinary tract infection. C. Risk for impaired tissue integrity related to the client's refusal to turn. D. Ineffective coping related to the response to positive biopsy test results. Answer. D. Rationale. The first part of the nursing diagnosis statement is the diagnostic label, and is followed by related to the cause, which should direct the nurse to the appropriate interventions. D. Best fits this criteria. A and B contain a medical diagnosis. C includes an observable cause, but D focuses on the client's response, which the nurse can provide support, reflection, and dialogue. Question number 5. A female nurse who sometimes tries to save time by putting medications in her uniform pocket to deliver to clients, confides that after arriving home, she found a hydrocodone, Vicodin, tablet in her pocket. Which possible outcome of this situation should be the nurse's greatest concern? A. Accused of diversion. B. Reported for stealing. C. Reported for a HIPAA violation. D. Accused of unprofessional conduct. Answer. A. Rationale. Even if this is only one incident, the nurse may be suspected of taking medications on a regular basis and the incident could be interpreted as diversion. A. Or diverting narcotics for her own use, which should be reported to the peer review committee and to the State Board of Nursing. B, C, and D are also of concern, but A is the most serious possible outcome. Which statement correctly identifies a written learning objective for a client with peripheral vascular disease? A. The nurse will provide client instructions for daily foot care. B. The client will demonstrate proper toenail trimming technique. C. Upon discharge, the client will list 3 ways to protect the feet from injury. D. After instruction, the nurse will ensure the client understands foot care rationale. Answer: C. Rationale. An objective should contain 4 elements: who will perform the activity or acquire the desired behavior, the actual behavior that the learner will exhibit, the condition under which the behavior is to be demonstrated, and the specific criteria to be used to measure success. C is a concise statement that is a learning objective that defines exactly how the client will demonstrate mastery of the content. A, B, and D lack one or more of these elements. Last question. Client with Raynaud's disease asks the nurse about using biofeedback for self-management of symptoms. What response is best for the nurse to provide? A. The responses to biofeedback have not been well established and may be a waste of time and money. B. Biofeedback requires extensive training to retrain voluntary muscles, not involuntary responses. C. Although biofeedback is easily learned, it is most often used to manage exacerbation of symptoms. D. Biofeedback allows the client to control involuntary responses to promote peripheral vasodilation. Answer: D. Rationale. Biofeedback involves the use of various monitoring devices that help people become more aware and able to control their own physiologic responses, such as heart rate, body temperature, muscle tension, and brainwaves. D is an accurate statement concerning its use for clients with Raynaud's disease. A, B, and C do not provide correct information about biofeedback. Alrighty, thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Don't forget to like, comment, and subscribe for more.